Hello everyone, my name is Morgan Willoughby, and today I will be presenting my literature review on continuous glucose monitoring compared with self-monitoring of blood glucose by fingerstick in adults with type 2 diabetes. This presentation summarizes the literature search, research findings, synthesis of the evidence, and evidence-based practice recommendation developed throughout this course. My PICOT question asks, in adults with type 2 diabetes, how does continuous glucose monitoring compared with self-monitoring of blood glucose by fingerstick result in a greater reduction in hemoglobin A1C after 6 months of use? I selected this topic because diabetes affects millions of individuals worldwide, and maintaining glycemic control is essential for reducing long-term complications. As technology continues to advance, continuous glucose monitoring is becoming more widely available, making it important to evaluate whether it provides better outcomes than traditional fingerstick monitoring. For my literature search, I used the Youngstown State University Mag Library and searched EBSCO host databases. I limited my search to peer-reviewed quantitative research studies published within the last 8 years. Search terms included continuous glucose monitoring, type 2 diabetes, hemoglobin A1C, self-monitoring of blood glucose, and randomized control trial. After reviewing multiple articles, I selected 6 quantitative studies that directly addressed my PICOT question and met the assignment criteria. The first study was conducted by Nathanson and colleagues in 2025. This retrospective comparative cohort study included more than 5,000 adults with insulin-treated type 2 diabetes. The researchers compared intermittently scanned continuous glucose monitoring with traditional blood glucose monitoring. The study found that participants using continuous glucose monitoring experienced greater reductions in hemoglobin A1C after 6 months and had fewer diabetes-related hospitalizations. The second study by Hack and colleagues was a multi-center randomized controlled trial involving 224 adults with type 2 diabetes. Although both groups achieved similar reductions in hemoglobin A1C, participants using flash glucose monitoring experienced fewer hypoglycemic events, significantly fewer fingerstick tests, and higher treatment satisfaction. This study demonstrates that continuous glucose monitoring provides an important benefit beyond improving hemoglobin A1C alone. Wu and colleagues evaluated a quality control circle intervention designed to improve self-monitoring of blood glucose practices. The study found significant improvements in blood glucose monitoring adherence, reduction in fasting blood glucose, lower hemoglobin A1C values, and fewer hypoglycemic events. Although this study focused on improving fingerstick monitoring rather than continuous glucose monitoring, it reinforces the importance of consistent glucose monitoring for improving diabetes outcomes. Gunawardena and colleagues evaluated the Smart Glucose Manager mobile application in adults with diabetes. Participants using the mobile application demonstrated significantly lower hemoglobin A1C levels after 6 months, and greater use of the application was associated with improved glycemic control. This study highlights how technology can improve patient engagement, support self-management, and ultimately enhance diabetes outcomes. The final 2 studies also supported the use of continuous glucose monitoring. The fifth study, with Price and colleagues, evaluated episodic real-time continuous glucose monitoring and found modest improvements in hemoglobin A1C and time in range among adults with type 2 diabetes. The sixth and final study, with Lau and colleagues, combined continuous glucose monitoring with remote telemonitoring and virtual diabetes education. Participants receiving this intervention experienced greater reductions in hemoglobin A1C, greater weight loss, and a higher treatment satisfaction than those receiving enhanced usual care. Together, these studies demonstrate the potential benefits of combining diabetes technology with ongoing patient education and support. Overall, the 6 studies consistently support continuous glucose monitoring as an effective strategy for improving diabetes management. 5 of the 6 studies demonstrated improvements in hemoglobin A1C, while multiple studies also reported greater patient engagement, higher treatment satisfaction, fewer hypoglycemic events, and reduced diabetes-related complications. Although one study did not find a statistically significant difference in hemoglobin A1C between groups, participants using continuous glucose monitoring still experienced important clinical benefits, including improved quality of life and fewer fingerstick tests. Overall, the evidence suggests that continuous glucose monitoring provides meaningful advantages over traditional blood glucose monitoring for many adults with type 2 diabetes. Based on the evidence reviewed, continuous glucose monitoring should be considered for adults with type 2 diabetes who require improved glycemic management, particularly those receiving insulin therapy or those struggling to achieve hemoglobin A1C goals. Nurses play an essential role in educating patients on proper device use, interpreting glucose trends, encouraging adherence to treatment plans, and reinforcing healthy lifestyle behaviors. Incorporating continuous glucose monitoring into routine diabetes management has the potential to improve patient outcomes while supporting evidence based, patient centered nursing practice. These are the references used throughout my literature review. Thank you for your time, and I appreciate the opportunity to share my findings.